Well, with Spokane Public Schools in Central Valley going fully virtual in the fall, we've had parents reach out to ask what is the best way to approach this with our students. So we are bringing in an expert today. We have with us Dr. Estelle. She's a clinical psychologist with Cornerstone Psychologist. First of all, Dr. Estelle, thank you for joining us. And I'd like to start off
It's my pleasure.
With a question. And really, as we're talking about the kids going back to school and not being in the classroom, what can parents do to help their children with this new normal? It's been now 6 months since they've actually been back in a structured environment.
Yes, absolutely. Well, I can understand all the parents who are just sitting on pins and needles to know what is being expected of them as parents, and obviously they want their students to have a good experience. I would say from what I'm hearing in my practice, really facilitating the children to express their feelings of, concern, of sadness, of anxiety, of whatever they are feeling, and to have the home be a place where that's free-flowing in terms of what they're going through. We're all in this together, and I think that aside from really validating those feelings, it is primarily predicated on the parents taking excellent care of themselves. So, obviously, if the parent is being very regulated, taking good care of their health, making sure they have support and connections as they are able, they're going to be able to calm the children through their own modeling. So I really encourage parents to really take their own health very seriously in order to be at their best for their children.
That is excellent advice. We know that it was a real struggle for many parents last spring as they tried to adjust for this. We've also heard from many other experts that say really for children's mental health, it's best that they have the daily structure of school and the social interaction with their peers. So what can parents do if later on, middle of the fall, they begin to be worried about their own child's mental health?
Well, obviously to help with preventing that, creating a schedule at home for in-home learning or remote learning would be encouraged so that the children are on a schedule and know what to expect as much as possible. Certainly any changes in your child's behavior, in their mood, in their activities, in their energy level, in their appetite, their sleep habits, any changes like that might be a signal that they are not doing well emotionally. Again, if you have had a practice in your home to express feelings and emotions, it should be readily available in terms of information for the parent to be able to assess if their child is having a change and a worsening in their emotional state.
So once again, let me just touch again on the parents. I think that probably what you brought up earlier is probably key, that for the parents who are feeling a bit overwhelmed right now, they're working full-time jobs and they're trying to, structure their children at home, and they can, many of them are single parents, and they can feel very overwhelmed. Any more tips for those folks?
Absolutely. Well, I would encourage those parents who are feeling, that increased stress to reach out and perhaps get their own therapeutic support. It's often we don't know where to go with those heightened emotions, maybe some high anxiety, some depression that might lower their functioning. So certainly if there are any, levels that are beyond what their normal is, I would say reach out. Short of that, certainly reaching out to the support system there and know that we're all kind of in this together. So all the parents that they might have been raising their children together with, those would be good people to talk to, get ideas, and get support because, it's challenging. And also to be keeping the ear to the ground about community, what the community might be offering to parents as we go through this. I'm sure things will spring up that the school would have direction to give them.
Well, we thank you for the good work that you're doing. That's Dr. Estelle, clinical psychologist with Cornerstone Psychologist. Again, thanks for all the good advice you've given us tonight. Whitney?